many people who are just looking for clarity and answers and feel that their loved ones have been kept safe. During this time period, as I spend hours in the weekends talking to constituents and families, I ended up actually losing one of my uncles at a nursing home. His name was Song Kim, and he had dementia for 7 years. My father just saw him a month ago. And while I was so busy helping others, I had no idea that my uncle was sick in a nursing home and he didn't get the proper treatment. And we're still waiting. I know his body is kept at a place in New Jersey. We're still waiting for answers. So in this moment, I joined thousands of others, and some have, one person have joined us tonight to speak. And I share the pain and trauma that is so real for all of us during this time of crisis. These tragedies in nursing homes are not accidents. They're the outcome of bad policy decisions. This is a result of decades-long pursuit to strip the state of its resources and hand over the reins to for-profit businesses. If you're a for-profit nursing home that is invested and financed by the private equity firms and are driven by quarterly returns, and your managerial performance is determined by profit margins rather than saving lives, what do you expect the nursing homes to do? They will extract as much money from Medicaid without spending a dime more on PPE or staffing. The long-term solution is to identify new revenue streams, to implement takeover plans if nursing homes are not doing their job, to make sure that every facility is not driven by profits, but a mandate to protect and save our seniors' lives. In the coming days, I will be introducing a lot of legislation to leverage the money provided by the Federal Reserve under the Municipal Liquidity Fund to execute this goal. But right now, in this moment, we need immediate solutions to save lives. Now is the time for smart, compassionate government designed to protect our most vulnerable, which is why we're introducing our legislation. Our bill will direct DOH to actively monitor and support nursing homes with PPE, transferring of residents who are COVID positive or exposed to COVID, providing families with tangible options such as home care, and implementing an emergency takeover plan if the nursing home or long-term facilities can't protect their residents. Under this bill, DOH will provide tangible options for families if they want to take out their loved ones from nursing homes. The bill will also direct nursing homes to allow families to communicate at least 3 times per day and report on a daily basis to DOH their PPE status and staffing needs. Let me take a moment to thank Assemblywoman Gunther, who has championed another legislation to mandate safe staffing in nursing homes, which I fully support. I also want to thank Speaker Carl Heastie and his team for working with us for the last several days to work on this legislation and put this forward. And lastly, Governor's Cuomo staff has been listening and working with us to issue executive orders to put band-aids to make sure that we're going the right direction. And he also announced something today as well. But obviously it's not enough, and we need to do a lot more to save these lives. With that, let me hand this over to the Senate sponsor, Senator Andrew Gonzalez.
There you go. Thank you very much, Assembly Member, and thank you everyone for joining us today. I won't rehash what the bill does, but really I think it's incredibly important that we take stock of where we are right now and what this moment means. Everyone on this call has, especially all the elected officials, have experienced unspeakable tragedies in our districts. We've all heard from the loved ones of family members who have they've lost people in nursing homes. We've heard from family members who have been unable to get in touch with nursing homes to check on their family members, on their loved ones, on their parents, on their aunts and uncles. And we've heard from people who are suffering. In fact, just today, an hour ago, I had a report from a constituent that despite the governor's executive order, one of the nursing homes in Southern Brooklyn was still not communicating with family members. And just before we got on this call, I got another email from a constituent saying that she reported that her mother was sick to the doctor and did not get any care for 2.5 weeks, and is just terrified and frightened and doesn't know what's going to happen. So there's a big gap here between what the level of care that we should be providing, that nursing homes should be providing to those entrusted in their care, and what those residents are actually getting. And unfortunately, it's taken a tragedy like this, the coronavirus, to lay bare so many of the weaknesses that have been exposed in our society: workers' rights, fair pay, inequality, access to health care, and especially how we are treating our most vulnerable, our seniors or those who are elderly or frail or ill. So I'm particularly happy, not happy, but really want to stress the necessity for transparency and accountability, and that needs to be open lines of communication between the nursing homes and those in government. There needs to be open lines of communication between nursing homes and family members. I'm sure all of us on this call have gotten phone calls from our nursing homes saying, we need help getting supplies, we need help getting staffing. But then when we ask a question on behalf of our constituents, we get radio silence, which I can tell you has happened multiple times in my district. Or when we will make phone calls on behalf of our constituents and not get any calls returned. That's just unacceptable. And so we really need to make sure that we are establishing these lines of accountability, making it crystal clear that if there's failure to comply, there will be a state takeover. There will be teeth to these regulations. And let's be very honest, it's not just nursing homes that are to blame. Many of the nursing homes that are in our districts have been trying to manage the best they can with a lack of supplies, a lack of staffing, confusing regulations and orders coming down from the state initially. There's plenty of blame to go around. But the goal here is that we make sure that we are never in a position where we are putting our most vulnerable in danger ever again. And that is why I'm particularly proud to be sponsoring this legislation. I want to thank Assemblymember Kim for working on this. And I want to thank Senator May, the chairwoman of the Aging Committee, as well, for joining us today, because I know this is a particular issue that's affecting not just nursing homes in Southern Brooklyn, where I represent, or in Queens, where the Assemblymember represents, but really across the entire state. I'm very, very hopeful that we can provide some meaningful relief to the people who are counting on us to take
Right on to that.
Thank you, Senator. Before we move on to the next speaker, I just ask everyone who's not speaking to mute your computers or your phone so we don't interrupt our speaker. Thank you so much, Senator, for taking this legislation on. Next, let me introduce and bring up Senator Rachel May from upstate New York, who is also the chair of the Aging Committee in the State Senate.
Thank you, Ron, and thank you for bringing this legislation forward. Under the best of circumstances, nursing homes face challenges in this state. And as chair of the Committee on Aging, I have been engaged in addressing issues like workforce challenges, staff shortages, and the precarious financial situation of a lot of these institutions in urban and rural settings alike. And I represent Syracuse, but I also represent an entire rural county. So I've got the whole range of different geographical opportunities for nursing homes to have these kinds of problems. We've worked hard on alternatives to nursing homes as well, especially in-home care, where the workforce shortages are actually even worse. So the toll this pandemic is taking on those living in nursing homes is both horrific and heartbreaking. The governor himself has called them ground zero for the coronavirus, and it's just spreading through nursing homes like wildfire. So nursing home staff are frontline workers in this virus, along with the doctors and nurses in hospitals. And we have to make sure that they have the tools and the protections they need to safeguard residents as well as safeguard themselves and their own families. We also, upstate, we're hearing nursing homes are being used temporarily to house recovering patients with COVID-19. So that makes it even more important that we have all of these safeguards in place. And making sure the families have information. Families put their loved ones in nursing homes as a last resort. They need the care and they need to know that their families are safe. And early on in this pandemic, the information really wasn't getting out. And as we just heard, it still isn't always getting out to people. So this legislation would make a big difference so that family members can make the best decisions on behalf of their loved ones if they need to. So we've taken some steps to require more communication with family members, but I think this bill that requires daily communication is really an important one. And it will not just put people's minds at ease, but it will do more to prevent future outbreaks. So I want to thank Assemblyman Kim and Senator Gurnardis for bringing the legislation forward. I want to thank AARP for its invaluable advocacy and support of New York seniors and nursing homes and their families. And after this, after we answer the immediate critical need that we face from this pandemic, I hope we take this moment as a wake-up call to really think about how we treat and care for our elders and how we invest in their care and in the people in the institutions who serve the frailest among us. So thank you very much again. And I'm looking forward to co-sponsoring this bill.
Thank you, Senator. Thank you so much for your leadership. Next, let me bring up my good colleague from Poughkeepsie, Dutchess County, Assembly Member Jonathan Jacobson.
Thank you, Assemblyman Kim, and thank you, Senator Gurnardis, for sponsoring this bill. I represent the Hudson Valley. I'm from Newburgh. I represent Poughkeepsie, Beacon, in that area. And just like the coronavirus, the problems of nursing homes knows no boundaries. It knows no districts. It makes no difference where you live. The problems are throughout. We know that the nursing home residents are among society's most vulnerable members. They're the most vulnerable because they're in a closed area. They can't leave, and particularly with the infection from the coronavirus. They have pre-existing health conditions, which even make them more susceptible. Even before this emergency, conditions in nursing homes were not good. The staffing is never there. There's not enough nurses. Too much work is being shifted to nurses' assistants, and it's not working out. Also, what has made it worse this year was the March 25th directive from the Department of Health, which forced nursing homes to take infected patients. Nursing homes are not hospitals. They should never have issued this order. The order said that they were not allowed to reject a patient solely on the basis of having or suspected of having the coronavirus. And yet, so nursing homes were afraid to say no, and they were taking patients that they could not care for. Now, it seems to be a little change in the attitude of the administration that these nursing homes don't have to take these patients, but they should never have to be put in that situation. The Department of Health should never be given license to dump infected patients into facilities which are not equipped to handle them. The minimum staffing levels must be mandated and enforced. All staff must have the proper personal protection. And we have to do everything we can. This year we had problems in the budget. We cut funding for home care for seniors, which meant more people will end up in nursing homes at much more cost. So that was a really bad mistake in this year's budget. And this is all over. Just today, there was a news report of a nursing home about 30 miles north of my district and a little north of Kingston that had 27%. It was 70 72 out of 293 residents that were positive, COVID positive. I mean, that's nothing but a petri dish for the rest of them, and it's terrible. And we're hearing these horror stories throughout. So I really am so happy to co-sponsor this bill, the fact that you've come quickly on it, because this is not theoretical, this is not rhetorical, this is real. And every day goes by, we find out more and more what's going on in our nursing homes, and more people are being infected. So thank you for doing this. And we should always remember on who we represent and the seniors that are always affected.
Thank you, Jonathan. Next, let me ask Beth Finkel, the State Director of AARP, to say a few words.
Thank you so much, Ron and Jonathan, Andrew and Rachel. We really appreciate the advocacy that you're doing for New Yorkers. I am representing the over 2.5 million members of AARP across New York State. And as we look at what's been happening with nursing homes, we have a lot of concerns about the transparency, lack of transparency, and the need for more communication with families. And I know you're going to hear from someone directly about that, but I do have to tell you that yesterday I got a call from one of our volunteers, and she let us know that she had an aunt. She's in Brooklyn. The aunt was in Manhattan. They were trying to get a hold of the nursing home for the last 3 weeks, and they could not get a return phone call from anyone in the nursing home. So they turned to us, and we tried to help them make contact, and ultimately they did get through. And here's what they found out. This woman's aunt died on April 9th, and yesterday was April 28th. So in all that time of the family reaching out to find out how their aunt was, she in fact was already gone, and they didn't even have a chance to know that. It's really unconscionable. So I think, as Senator May said, and she's so right, that families, it's not like they say, oh my God, I want to get my loved one into a nursing home, right? They do it because they know they're going to get the care that they need at that point in time. And so it behooves all of us as a society to step in and help those family members help their loved ones, because they're the ones that can advocate for their loved ones in the nursing homes, because very often people who are in the nursing homes really cannot advocate for themselves. And if, God forbid, they come down with the coronavirus, they're going to be less likely to advocate for themselves. So this is exactly the time that we have to make sure that there's open and honest and timely communication, which is what's so good about this bill, saying that people have to be in contact every single day, and the PPEs are in there. And so this is all very, very important, both for staff, but most of all for the patients, who really deserve to have society make sure that they are well taken care of. So I thank you all for doing this press conference today, and AARP is very much in support.
Thank you. Before I bring up the final and main speaker, if any member of the press has any questions, feel free to raise your hand through Zoom, or you can type in your question on the chat room. And my staff are actually monitoring all the social media outlets, and they will be typing in questions from there into the chat room as well. Next, let me bring up Livia, who reached out to me while I was trying to get answers for another constituent, because her father was also stuck in the same nursing home. And in the middle of trying to get answers, he ended up passing away a few days later, a couple of weekends ago. And even after he passed, she's still looking to get answers. I mean, just imagine the horror when you're calling and calling and calling, and the one phone call that you get is to tell you to come in and arrange your funeral services. I mean, that's what's happening to thousands of people around the state of New York. And it's just heartbreaking and it's unacceptable. So with that, Lydia, thank you for joining us, and we'd love to hear what happened.
Thank you. Um, my father has been in a nursing home for 3 years, and we as a family, we always went to go see him every week, faithfully every single week, until this pandemic came to affect everyone. They closed down the the doors to the visitors, so we weren't able to see my father after March 11th. Um, all I could say is that after March 11th, it was hectic and very frustrating, stressful to get in contact with him because I wasn't able to find out, what his status was. And I was really worried and scared, and I didn't know what was going on with him. And they would always transfer me or they would put me on hold. And when finally I would get someone to pick up the phone, they would tell me, oh, you have to talk to the head nurse. The head nurse will have to get back to you. When I finally, eventually, after so many trials, I would get the head nurse, and the head nurse would tell me she would call me back because she's not in front of a computer. And basically, it was like a circle. Every time that I would call, I was going into a circle. No answers. Eventually, one of them actually told me, oh, you can do video calls. So I was pleased with that. I said, okay, at least I could do a video call with him. Recreation was on top of it. I would do video calls at least 3 times a week. And my father seemed fine. The last time I saw him, that he was in decent health. He was sitting in the wheelchair. He was trying to talk to me because my father didn't really talk because he has dementia. And he seemed fine. That was April 11th. Now, I'm sorry, April 8th. Now, on April 11th, I was trying to reach them. On April 8th was a Wednesday. I tried to reach them on Thursday. I tried to reach them on Friday. I wouldn't get no answers. The same thing started again. They wouldn't return my calls. Until finally I reached somebody after like 10 trials on Saturday to tell me that my father was in a deathbed, that I was gonna lose him. He was on oxygen. His blood pressure went down, and they told me just to prepare myself. I was in shock. I couldn't understand why they did that to me. I was like bewildered. I couldn't understand why they didn't call me. Why didn't they reach out to me and tell me my father was sick with it, that he wasn't able to breathe on his own? They waited for me to reach out to them, which I didn't understand that. But make a long story short, I kept calling to keep checking up on him. I told them I want him tested. Does he have the virus? They told me they couldn't test for that. I said, is anybody else there sick? They said people have been in and out. They didn't tell me exactly what they had, but it was pretty obvious they probably had the virus. I wasn't getting any answers. I was just very persistent in trying to find out, does he have the virus? Get him tested, please. Let me know what's going on. Is it that? Because how does a man from, the 8th to the 11th, in a matter of 3 days, and now he's on his deathbed? And I didn't understand that. I kept trying to call, and in between, I would do video calls even though my father was on the oxygen. And a week later, he passed away. So I still don't even know if he had the virus or not. I've been telling them to please test him, to please let me know if that's what he died from. They told me that there's nothing they could do now. He's gone, and I just have to deal with what and accept the fact that he's gone. Which, even now, with all this going on, and I'm trying to get all the paperwork together, his death certificate was returned so many times because they even got the wrong time. even on the death certificate, I told the doctor, I said, I want it to be said what he had. I want to know what he had from the medical examiner. He said, all I can say is that it's presumed that he had the virus. When I got the paper back, he put down that he was presumed to have the virus a day before his death, which I'm still trying to get that corrected, because a week prior to that, when he was still alive and he was under the oxygen, I had asked for them to test him. So if that's the case, he was presumed to have it for a week at least, at the very least. But I'm still waiting for that paperwork. So it's still going on. I still hear stories. My mom just got a call not too long ago. Another friend of ours was also diagnosed with the virus. He was in a hospital, and they were going to send him to a nursing home. So this is still going on. They keep disregarding the elderly people that are in the nursing homes. They consider that, I'm sorry to say, but they're considering it a dumpster. They're dumping everybody that's infested into the nursing home. They're understaffed. They can't handle the situation. And it's just ridiculous. And we keep losing more and more people. And we should actually be more receptive to them, because they're fragile. They're the ones that are under these conditions, these fragile conditions. They're elderly. They keep saying that we need to take care of them the most, but they don't. They just keep dumping more people that are infested with this virus into these places, and it's ridiculous. And I keep hearing more and more stories over and over again, people that we've known. And that same week that my father passed, as my mother is getting condolences, she's hearing more and more stories from the same place that people were passed. They passed that same week, if not that week, the week prior, which are people that were on the same floor as my father. And my father was the type of person, he would watch over everybody in the nursing home until he started losing his speech. So he knew a lot of people. He was very well loved in the nursing home. He knew everybody from the maintenance man to the highest nurse. He knew everybody. But now he's gone. I can't do anything, but all I can do is speak for him and try to get this out. And if you guys can get this bill passed, and the sooner the better, to save other people's lives. My father's gone. I can't do anything about it, but at least all I can do is fight for him.
Yeah, I think we can, I can speak for everyone that we are so sorry for you and your family and the thousands of others who are going through the same ordeal. And we promise you that we will honor your father as well as my uncle and others by getting this right. It's not, again, it's not acceptable that we are in a city, in a country, the wealthiest place in the entire world, and we fail to take care of people that we knew that were vulnerable to this. Forget, you know, when we found out the first thing or not, by the time this virus spread back in January, we all knew that people, especially older adults with underlying conditions, were the most vulnerable to this virus. And there is a colossal governmental failure at all levels. And there will be a time, I know I'm joined by the aging chair, Senator May and Senator Jacobson and Cornelis from Brooklyn, and other members will make sure we hold everyone accountable post-pandemic. But right now, we're putting this legislation forward because we need to save lives right now. And I think by putting these measures, we will achieve that. The bill number, just to clear, went live as we're speaking, is A10350 on the Assembly website. And before I go to questions, let me just clarify what the bill does again. The bill aims to provide a clear framework in which the Department of Health can provide better oversight and guarantee accountability from administrators of resident healthcare facilities and nursing homes, as well as provide the means through which the department can actively intervene and ensure that the residents of the facility are receiving the proper quality of care that they're entitled to. The DOH must issue guidelines to all residential healthcare facilities on proper medical procedures, which include but are not limited to maintenance and record keeping of daily personnel protective equipment, PPE usage, frequent communications with the residents and the loved ones of any confirmed or suspected infections within the facility, informing residents of alternative care options, including home care pursuant to Article 36 of the Public Health Law, and ensuring at least 3 daily communications between the resident and their relatives. The department is additionally authorized to allocate public health emergency appropriations to facilitate the procurement of alternative care services for residents to opt to receive them. The bill also requires residential healthcare facilities to provide daily reporting to the Department of Health and local health departments on metrics related to the spread of diseases within that facility. Finally, the department is then required to publish this data for public scrutiny on a weekly basis. And lastly, the bill outlines the grounds on which a temporary operator appointed by the Commission of Health assumes operational control and responsibility over a residential healthcare facility. With that, we're going to take a couple of questions. We have Josh Sheffin. He's hi, is it clear that private equity-owned nursing homes are faring worse than others in this crisis? Thank you, Josh. That is a question that we broached at the very beginning of this. We are actually going through the data right now. Josh, are you on? Are you still on the call? Okay, he's on mute.
Yes, I'm still here. Thanks, Ron. I appreciate it.
Okay. Do you want to ask further, or is that the question?
Well, you raised it, and you mentioned their shortcomings and their failings, which I appreciate, and I know there's some literature, a lot about their performance in the past. But I just wondered if you had any visibility that private equity homes were really particularly disastrous in this situation, or if it was across the board. If there was if you had any idea on that front. Thank you.
We're actually dissecting the numbers right now as we speak, with the help of a couple of legal scholars from Cornell University, and we'll be reporting those numbers back hopefully by tonight or tomorrow.
Great. Thank you so much, and good luck.
Thank you. Okay. Kai and
Ron, can I just add to that there was a study that came out just about a month ago that showed that private equity nursing homes tend to lay off frontline nursing staff and do other cost-cutting measures that have materially jeopardized care for people in the nursing homes. And so we can only assume that that is also carrying over into this crisis and probably exacerbated in this crisis. So yeah, I think the answer, it's a guess, but it's an educated guess that it is a real problem.
thank you. All right, let me mute her. Okay. If you have any other questions from the media, we'll take one more question. Otherwise, we'll go to social media to see if there's any questions on social media. Anyone? Okay. Well, thank you all for joining today. Thank you, senators. Thank you, Assemblymember Livia. Our hearts with you. We're going to continue to get answers and figure this out with you. And of course, AARP for all that you do for our older adults in the city of New York. Thank you so much, and please go look up the bill, A10350, and help us get this passed. Thank you.
Thank you.
Thank you, everyone.